Good oral health and good overall health. Are they related? Is there a tight connection between your mouth and overall body? Do you have any signs and symptoms in your mouth which can point to me that you might have a bigger problem? I'm Dr. Olga Dolghier here at Palm Valley Pediatric Dentistry. I'm board-certified pediatric dentist and laser dentist. A lot of signs and symptoms we see in your mouth can represent something bigger. Let's figure it out what are those signs are and when do you need to pay attention? When do you need to see your dentist very, very soon? And when should you not worry about it at all? There is a common condition which can pinpoint that you have a bigger problem. For example, if you have gingivitis or periodontitis. Gingivitis is a gum disease. Periodontitis is a chronic condition caused by certain type of bacteria when you actually losing bone and supporting tissue of your teeth, and teeth get loose and you actually can lose your teeth. Periodontitis is a really serious and concerning condition which needs to be maintained. There is some study which point that people with periodontal disease may have actually cardiac or heart problems, and they actually did a study when they biopsied the heart valve and they found that bacteria on the heart valve was exactly the same as in your gum. So there is a correlation between those two. So what does it mean? Does it mean you're going to have heart disease if you have periodontal disease? It's all about inflammation. Periodontal disease or gum disease, gingivitis, it's chronic type of condition and chronic inflammation which needs to be maintained and addressed on a daily basis. Those boring flossing I was telling you about, seeing your dentist every 6 months at least, and getting that inflammation under control. More chronic inflammation you have in your body, more problems you can potentially have. People with untreated diabetes will present with periodontal disease because diabetes affects small blood vessel and it does increase inflammation in the body as well. People with dementia, now they're blaming periodontal disease as well. So there was a correlation in one study between plaque in the brain and bacteria in the mouth causing inflammation and potentially crossing barrier between your brain and blood vessels. So it's very serious and concerning. So don't ignore the problems in your mouth. I'm a pediatric dentist, so my job is to set up a good oral health for your child that they don't have long-lasting problems. Sometimes conversation we have with your child or mom or dad can be very, very sensitive. Sometimes I ask you, did you guys have vaccination? Because vaccines, actually HPV is a virus which can cause oral cancer. Now we can vaccinate our children. I did vaccinate my own children for HPV vaccine because that's long-term prevention for oral cancer. Surprisingly, but most of the oral cancer and throat cancers are caused by HPV virus, human papilloma virus, and prevention is the key. So your mouth can really affect your overall health. Also, April is Oral Health Awareness Month and also Awareness Month for oral cancer. So oral cancer can present different ways. When we have older patients, it's not uncommon to see red lesion or white lesion, and your dentist should screen for it every single time they see you. And if they see those changes, they will refer you for biopsy. It's not uncommon to see oral cancer. How to prevent oral cancer? It's all the same technical things you do for overall body. You have to make sure you don't smoke. What happens with smoking? Blood vessels in the mouth actually constrict, and there is chemicals in cigarettes which can affect mutation, and then you will have mutation in your superficial cells in the mouth, and on top of it, if you have papillomavirus, your overall health of the mouth is changing, and then you can develop potentially cancerous lesion on your cheek, on your tongue. Tongue is very common actually. So drinking excessively, that's actually can cause cancer as well, oral cancer in particular. So all those good lifestyle changes, prevention, healthy choices, good diet, it all affects your overall body, and your mouth is not separate from your overall body. Those chronic inflammations with untreated cavities, abscesses, can turn into something much more bigger and more serious. So don't ignore the signs you have in your mouth. Make sure you see a dentist, make sure you check, and don't ignore those symptoms. Please pay attention and make sure you keep your diet healthy, your oral hygiene healthy, and also make those healthy choices in life. That's my advice for you. Comment below if you ever heard about relationship between gum disease and dementia, or have you ever heard about oral cancer in general and what causing oral cancer? Did you get your HPV vaccination when you were younger? Comment below, let me know. Thank you so much for watching. Cannot wait to see you in next videos. Bye.